Hi, I'm Jennie, the Fascial Stretch Therapist at Lake Chiropractic and Physical Therapy.
Right now, I am checking the patient's hips, making sure if the patient is hypermobile, which in his case, he did not have hypermobility. And at this moment, I'm assessing patient's femurs, checking if his legs are tense, if there has any tension, which I will be doing in both legs to make sure that both are good. And as for here, you see me doing gentle moves. That is because I am doing the general assessment for the straight leg raise to make sure where the patient's R1 is and where their tightness can be. So therefore, I have to do it in a nice gentle motion so I can start that proper assessment and I can start warming up the patient's body and tissue. So right now I'm actually going into the stretch, and as you guys see how I bring it up, it's just a little bit because that's when I add a little bit of the PNF to put that extra stretch on the patient's body. And as I mentioned, what I do to one leg, I also do to the other one, so both legs can have the same effects. After the straight leg stretch has been done, I add a little bit of traction to properly finish it off. And as you see here, I always strap one leg to keep the proper function, because when the patient is laying on the bed, your leg tends to want to go the other way, your body wants to move the other way. So we can keep proper focus. That's when the legs are strapped so it can better assist. And as we see here, I am checking the range of motion and if any arm is either going to stop at a certain point, or if the patient is going to say, hey, this right here bothers me when you move it this way. That way I can make sure that everything is okay. Here we're slowly seeing myself working into the tissue, into the patient's shoulders. To start the proper stretch for the patient, I start by gently giving the body, the tissue, the joints some love, just gently paying attention to the body's tissue. Right here, you see me going in for the stretch and going in for the shoulder flexion. As is one side is done in the other side. The goal here is to target the tissue within the FN, the DBAN, the SBAN, and rhomboids lat triceps to increase overhead flexion. Hopefully that was helpful to you guys. Be sure to like and subscribe to our channel. We'll see you guys next week.